Disc herniation. In this video, we will talk about types of herniation, stages of herniation, related signs and symptoms, special tests for its diagnosis, complications related to it, and its management. Herniation of disc. A herniated disc in the spine is a condition during which nucleus pulposus is displaced from the intervertebral space. It is a common cause of back pain. Unlike the mechanical back pain, herniated disc pain is often burning and may radiate into the lower extremity. Types of herniation. The disc herniation can be divided into three types: posterolateral disc herniation, central or posterior disc herniation, and the lateral disc herniation. Posterolateral disc herniation. Protrusion is usually posterolateral into the vertebral canal. Protruded disc usually compresses the next lower nerve as the nerve crosses the level of disc in its path to its foramen. For example, protrusion of L5 usually affects the S1. Lateral or posterior herniation. It is less frequent. A protruded disc above second vertebra may compress the spinal cord itself or may lead to cauda equina syndrome. Now, lateral disc herniation. Nerve root compression happens above the level of herniation. L4 nerve root is more often involved. Stages of herniation. There are four stages of disc herniation. Number 1, bulging. Number 2, protrusion. Number 3, extrusion. And number 4, sequestration. Bulging. Extension of the disc margin beyond the margins of the adjacent vertebral end plates. Protrusion. The posterior longitudinal ligament remains intact, but the nucleus pulposus impinges on the annulus fibrosus. Extrusion. The nuclear material emerges through the annular fibers, but the posterior longitudinal ligament remains intact. Sequestration. The nuclear material emerges through the annular fibers and the posterior longitudinal ligament is disrupted. A portion of nucleus pulposus has protruded into the epidural space. Signs and symptoms of herniated disc. Severe low back pain, radiating pain. Walking can be painful and difficult. Muscle spasm, tingling sensation, weakness or atrophy of muscles, loss of bladder and bowel control, and antalgic gait. Special tests for diagnosis in the cervical region are Sperling test, distraction test, upper limb tension test, shoulder abduction test, and Tinel sign. In the lumbar area, the straight leg raise test, the contralateral straight leg raise test, muscle weakness or paresis, hyperextension test. Complications of herniation are cauda equina syndrome, chronic pain, permanent nerve injury or paralysis. Physical therapy management. There are a number of exercise programs for the treatment of symptomatic disc herniation. For example, aerobic exercises, for example, walking and cycling, directional preference, including McKenzie approach, flexibility exercises,